They bother people anyways, but the length of the suture, it does bother them more. Okay, so post-op instructions on this. So now they're sewn up. We do use an Optigate, and we do use a bite block on surgical extractions. So again, it's Vaseline on the Optigate. Optigate gets placed, bite block gets placed, and we do. So surgeries do use Optigates and bite blocks. So we remove all that. We rinse out really good. We get all the blood gone. Have the patient feel good. Post-op instructions is low resting heart rate for 3 days, and the day of the surgery counts for day 1. That's one of our biggest things to let them know. Low resting heart rate. What does that mean? You just have a normal 72 beats a minute resting heart rate. You're not lifting weights. You're not running. You're not biking. You're not jogging. You're not bending over. You're not exerting yourself. You're not getting excited. You just need a low resting heart rate for 3 days. There is a scientific reason for that. When your heart rate increases, your bone is highly vascular or has a lot of blood in the bone. As your heart rate increases, more bone gets pushed and more blood gets pushed through the bone. I have all these loose particles in your socket. It literally will pump the bone grafting right back out. It's like turning on your hose more and more and more until it just blows out. So a resting heart rate goes slow enough, the flap will hold the bone in place as long as you don't get too excited. After 3 days, there's tissue attachment. It's harder to lose the bone graft after 3 days from the blood problem. Okay, yeah, so resting heart rate, and the antibiotic is the biggest drug on this case. We really don't have a lot of problems with post-op pain. In fact, since you've been here, Daniel, have we had a patient come in that like the next day or something? I mean, mostly people are just really comfortable. We don't have a pain problem here on our surgeries. But the big part of the surgery is that antibiotic. They have to continue on the antibiotic for 7 days. The next part is after 2 days you use the rinse. That just promotes healing. And the last part is on the first day of the surgery, you're welcome to, we give you enough drugs for like 3 or 4 days. We give you 16 taps, so that'd be like 4 days worth of drugs. Mostly you just need 1 day of drugs. But for some people, they don't, and they want to have more. So instead of them having to call me, we hardly ever give out a second amount of hydrocodone. It's a rare event. I did recently, and I went to 4 tabs, and we knew the guy had a codeine problem. He was in the office every day. So we ended up giving him just 4, and the next time he came in, he didn't ask for more. So it turned out fine. Okay, and that's it for the bone grafting. We see him in 7 to 10 days. We remove the stitches, and
is the suture needle in this?
Yes.
Okay.